Hello Zinat. Now I'm going to inspect your nose, mouth and neck. Now I'm going to inspect your nose. Inspecting the anterior and inferior nose for asymmetry and deformity. A normal test of obstruction by pressing on each LNA and asking the patient to breathe in. Now shine a light into a vestibule to get a partial view of each nasal vestibule to inspect inside of the nasal passage by using otoscope or pen light. Now note the color and condition of the nasal septum. Now let's palpate. Palpating for sinus tenderness, press frontal sinuses and maxillary sinuses. So now let's inspect your mouth. Now, here we will be inspecting the outer surface of the lips for symmetry, color and moisture. Note any lump, ulcer, cracking or scalings present. Now we are inspecting the oral mucosa for color and ulcer. Now, noting the color of the gum, inspect the gum margin and interdental papillae for swelling or ulcerations. Usually untreated caries can lead to bacteremia and endocarditis. Now I'm inspecting. Checking the tooth that might be loose and lead to risk for aspiration. Now let's inspect the hard palate. Very good. Now note the movement of the soft palate and uvula. If the patient's tongue obstructs your view, use the tongue blade to depress it. Inspecting the tongue, note the symmetry and color. By pulling the tongue on the right side and left side, we'll be inspecting the undersurface of the tongue. Let's examine your neck. We'll be noting any masses or scars. Look for enlargement of parotoid or submandibular glands and note any visible lymph nodes. We'll be using the index and middle finger to palpate and move the skin over the underlying tissues in the each area. Now feel for the preauricular, posterior auricular, occipital, tonsillar, submandibular, submental. Superficial cervical, and posterior cervical nodes. Now palpate the posterior cervical chain along the posterior edge of the sternomastoid. And now inspect and palpate the trachea for deviation place. Place your finger along one side of trachea and note the space between it. Here, inspecting the region below the cricoid cartilage for the gland. With the help of the tangential lighting, you should be able to see the lower shadowed border of the thyroid glands. Now drink some water. Ask the patient to extend her neck back slightly and sip some water and swallow. Observe the upward movement of the thyroid gland. Place the fingers of both hands on the patient neck. Again, ask the patient to take a sip of water. Feel the thyroid isthmus rising under the finger's pad. Note the lateral margins in the similar fashion. Examine the left lobe. If the thyroid gland is enlarged, listen to the lateral lobes through the stethoscope.